While the world waits for a vaccine to ease coronavirus concerns, many parents are forgetting about existing vaccines the pediatricians warn kids need to prevent diseases that have been largely eradicated in the past so that they don't make a comeback. In some areas, the number of childhood immunizations is down by more than 42%. San Francisco-based Dr. Yakusa Fukuda is the chair of the American Academy of Pediatrics in California. They represent about 5,000 pediatricians across the state, and she's now here to talk about the importance of getting those vaccines during quarantine. Thanks for taking the time to talk to us, Doctor.
Sure. Thank you very much for allowing me to speak. I am a general pediatrician over 25 years in San Francisco, in touch with both the general pediatricians as well as the subspecialists. And we are all seeing, understandably, the worry and angst that families have about coming to the doctor. And one of the things that we really worry about is that children still come in to get their vaccines and their regular checkups.
And I understand that pediatricians have seen a dramatic drop in routine checkups as well as these vaccinations because people are confined to their homes and they're worried about getting coronavirus if they leave and come to the doctor's office.
That's right. And many of us have had to be very creative and thoughtful about different ways to try to protect children if they do come, such as seeing only well children separate from the sick children. We're doing a lot of telephone and video conferences best we can, but there are many things that we have to see children for, and one of them is for their vaccines.
And that's one thing that the Academy of Pediatrics has doubled down on the efforts to make sure the kids who get their vaccines get set up different hours during the clinic time to separate the healthy kids from the sick, as you mentioned. What else is being done to alleviate that kind of stress?
I think that's right. I think keeping your medical home and being in touch with your doctor is really being promoted because we're the ones that know you the best. And hopefully we can counsel you and figure out what can be held off on and what things are much more important. Separate from just knowing from in the office anecdotally that people are not coming in, there was a large publication that came out yesterday, and I don't know if you'd like me to speak to that.
Yeah, the CDC recommends that kids get 14 different vaccinations as they grow up, and the timing of the shots is important. So can you tell us a little bit about those concerns?
Yes, I certainly can. So the report that came out from the CDC, Center for Disease Control, is called the MMWR, which is basically a weekly report that comes out from the CDC on various health topics. And yesterday they came out with specific data that looked at vaccines, and how they measured that is there is a program for vaccine for children that covers about 50% of the children in the United States, primarily through Medicaid, Medi-Cal, and they also looked at data on administration of vaccines. And what they found was that there was a sharp drop-off from the middle of March, especially into April. This study looked at actually from January 7th to April 21st, but the drop-off happened in that particular month from mid-March till April 21st. And the ordering and the administration of vaccines has dropped off immensely, anywhere from 50%, especially to those that are under age 2 and below. But more strikingly were those that were above age 2 who are not getting their vaccines, and it looks about 10% of the total compared to last year.
What are the sicknesses that pediatricians are trying to prevent?
This data then tells us that many kids are not coming in for their booster shots before kindergarten for age 4 to 6. The important things that we're vaccinating against are measles, and certainly the Bay Area knows about the measles outbreak that we've had from time to time when the vaccination rate decreases. Whooping cough is a concern, and also meningitis.
So the CDC mentioned, again, 14 different vaccinations as the recommendation. Has that list gotten longer over the years, and why is that?
Well, I think it has, as more data and new vaccines come out to protect our public. But we have had issues about not enough vaccination of our population and outbreaks, particularly of measles and whooping cough. And so that's why I mentioned those. Also important is getting your annual flu shot. because what we worry about is if coronavirus does recur again in the fall after dropping off with all the efforts that we've done, that you can get co-infected, for example, with influenza and COVID-19, and children have shown that that can make them very sick. So getting your flu shot is also important.
What would you tell the skeptics who are really concerned about getting their kids these immunizations, who believe that there might be sicknesses that come as a byproduct of getting those vaccines?
I think that evidence shows that vaccines work, that we have prevented vaccines, prevented diseases that are protected by the vaccines. We call them vaccine preventable diseases. And that we know that when there are pockets of areas when the vaccination rate for groups of people drop, that we then have the disease. And those that are really, really prone are those that have underlying medical conditions, disabilities, asthma, premature babies that could be more prone, or children who have cancer that are immune suppressed, for example. So we know that that's important for the protection of our children.
And I know that despite the pandemic, there are also parents who might be concerned whether there is any evidence that vaccines for their kids end up providing some sort of a link between other illnesses like autism. Is that still a rumor, or has that been disproven?
That has been disproven in the science in many studies and has been laid to rest in the scientific field. But I do think that your checkups are important, so that not only that we can make sure that your child is growing, nutrition is good, that they're staying healthy, but also to look for their development. And those are some of the things that are very important for us to see you regularly, so that we can help you investigate things if there are any warning signs. If we don't see you and talk to you and see your children, then we can't help.
So basically, it's not just the concern about kids not getting vaccinated during this time of quarantine. Doctors seem to be worried about not seeing the kid in general because they need to be checking up on their general health.
Yes, definitely. And of course, with this COVID-19 and the atmosphere that is around us, the children are needing extra reassurance. I think parents are having questions about how to help their child also cope with what's going on. It's hard enough for everyone already, and children don't understand, but they're seeing what's going on around them. So I think the counseling and knowing what's going on with your child is very important. And the place to do it is in your pediatric medical home.
And going back to the conversation regarding vaccinations, tell me about the importance of why everybody has to be on board. Basically, does it mean that if people opt out and feel like that they don't want their kids to get a vaccine, that it ends up being obsolete?
So what happens is, with each disease, there is a certain level of vaccination in the population that you need, so that everybody gets the benefit of being protected. If you fall below that level, then you run the risk of having a disease come back in the community.
All right, thank you so much, Dr. Fukuda, the chair of the American Academy of Pediatrics in California, for joining us and talking about that. You're watching Chron On, the Bay Area streaming news 24/7.